Back. Now, Parliament's Health Portfolio Committee is calling for the acceleration of the vaccine rollout, and this follows an update from the Health Department on the acquisition of other vaccines. Now, the rollout program and the new Delta variant, the committee, of course, also expressing concern over the non-mentioning of those living with disabilities and special needs to also get the jab. So let's get more details and unpack this with the chairperson of the Portfolio Committee. That's Dr. Sibongiseni Dhlomo, who joins us online. Dr. Dhlomo, good to have you, and good morning to you. Let's start with the update that I understand you got from the Health Ministry, at least the Acting Health Minister, Mamoloko Kubai, about, other vaccines and its procurement. What's the latest?
Yes, thank you very much, and good morning to you and to our viewers. We had 2 days ago a meeting with the Acting Minister and his entourage, where we actually get these fortnightly updates as a portfolio committee. Yeah, the first part was to actually indicate what the progress that they are making in terms of actually acquisition of these other vaccines in the light of the more the merrier. Now, they were able to indicate to us that this is at an advanced stage with SAPRA, but however, you would be correct that the main answer will come from SAPRA in terms of actually granting the registration. Of course, SAPRA is follows a very rigorous process in terms of actually getting the applicant to receive the registration. Now, it actually looks like the applicants must actually fulfill those regulations that SAPRA has put forward. But we were informed that Sinopharm and Sputnik are really at an advanced stage. We still have to, as a portfolio committee, meet with SAPRA ourselves to get the progress thereon.
But, Mr. Dhlomo, I understand that at the same time you're not happy with the pace of the rollout program, actually expressing concern yourself as well as your committee members, and even feeling or rather, stipulating that the intervention of the private sector here might be necessary at this point at an urgent rate.
Okay, let's deal with the two processes. One, it was a concern that we raised as a portfolio committee. Also, the minister did acknowledge that, yes, they are far behind with the plans that they've actually indicated that they will. Of course, there are multifactorial points that actually makes this issue. One of it is the acquisition from the same pool of where everybody buys in the whole world, and the delays that you actually probably may be aware that happened in Gqeberha with the J&J. However, it is the suppliers themselves who are making a determination that they will be selling to governments and not to me and you as a private entity. So it's not them who are making that prescription. But we actually have called upon the minister to say, can we really accelerate now that you are able to get as many vaccines as possible, and please open some of those sites that we have not opened because we were short of vaccines. So we were actually appraised about, one, it's going very well with the teachers. Yes, they are still behind in terms of finishing all the healthcare workers. They are doing what they can in terms of getting the over 60, and they are all now beginning to register the 50 years and above.
All right, we'll have to leave it there and I suppose wait for the Acting Health Minister to address us. Parliament's Health Portfolio Committee Chairperson, Dr. Sibongiseni Dhlomo. Appreciate this time with you. And Gareth,